why do I need an astigmatism-correcting lens if I've never been told that I had astigmatism? We get this question a lot. One, a lot of patients who have never been told they had astigmatism have astigmatism correction that's being corrected in their glasses. It's just never been something that's specifically brought up in general because a lot of times, from an optical perspective, we consider astigmatism to be just a normal part of a prescription and not a pathological thing per se. That said, when it comes to cataract surgery, that astigmatism is a specific component that we want to consider, perhaps discuss, and perhaps correct with the cataract surgery. So when we bring patients in for cataract surgery evaluations, we get a series of measurements that, among other parameters, are measuring the curvature of the cornea. Now, the curvature of the cornea, the front cap, the clear cap on the front of the eye, is the aspect that will remain. It is the lens, the light focusing lens aspect of the eye that will remain when the natural lens has been removed. We're taking the natural lens out and replacing it with a clear lens implant. Both the cornea and your natural lens can be a source of astigmatism, although most of that tends to come from the cornea. So the cornea is the part that will remain. When we do these preoperative measurements, we're trying to isolate and estimate most accurately that we can the amount of astigmatism that's in the cornea, because that is the astigmatism that we need to consider and potentially counteract with the lens that we implant inside the eye. So it is possible to have minimal astigmatism, say reasonably good vision in the distance without glasses, or to have glasses that don't have a lot of astigmatism correcting power in them, but for these scans preoperatively to show us a reasonable estimate that after surgery, the amount of corneal astigmatism remaining will be enough to impair that distance vision unless we correct it specifically with a toric lens.